back up here. You would have thought that I had figured this out by now, but clearly I haven't. So a couple of things here. Let's just talk about them in some fairly decent form. Let's just see if I can get a window capture or something like that. Screen capture now. Let's do this. So the issue here is that, first of all, dental and vision. Let's just take a quick look and see what's going on the internet. See if we can get a better look at what is actually going on. I don't think it's going to be that pleasing, to be candid with you, because I want to say that dental vision is looking dead, as far as I can tell. Now, I guess anything can change, but because you are still talking about Washington, D.C., nevertheless, it is not looking good here for dental vision health, dental vision hearing, I should say. This is important because of the fact that Medicare Advantage has distinguished itself. There's no question about it, right? It's very obvious to me what has happened here, which is that the carriers, and we will talk about that carriers in a moment here, because there is a controversy in the world, which we're going to get into. So you can see it here. This is thehill.com. It's one of the two places they usually go to, which is thehill.com or politico.com. In terms of, what's going to say here. Let's see if there's any news headlines. Nope. Here, put stamp on party. Probably something like this. Yeah. So there seems to be the pushback, and it seems to be right from here. And we'll get to them in just a moment. Well, there we are there. Can we get to the actual website, please? Is that crazy? I had believed, candidly speaking, that I had believed that, in fact, that dental vision hearing would have been added. That's actually what I did actually believe, because I thought that it was so popular that there was no way that even with the question about cost, and the fact that I've pointed out the fact that there are these problems, inherent problems, in creating that the ability to pay. And despite the fact that there were going to be these different I have no idea what is this. Incredible. I see. They gotta have their own thing. There we go. So here it is. The package, etc., etc. We're gonna have to shut down the hill. It looks like Thursday, very influential. Blah blah blah. We'll see if there's Medicare anywhere in here. Yeah, it would Here it is. As of now, this looks to be the lay of the land, or this looks like to be where it is. It would expand Medicare to cover hearing, but not dental and vision because of Manchin's concern over cost and Medicare's own solvency. Is this right? Yeah, of course. Right. I mean, part of Maximize Your Medicare is the fact that you're going to have not only demographic challenge but also fiscal challenge. How are you going to pay? Becomes a question for the Medicare Trust Fund, especially if you're not going to, increase the amount of taxes in there. Okay, so you can see it here. This looks to be the update for where dental and vision is. Now that also means that Medicare Advantage is going to get some foothold. That is the only possible conclusion here because of the fact that most Medicare Advantage plans have embedded dental and vision. The trick here, the thing that you need to understand about the way that dental and vision are going to work under Medicare Advantage is the fact that there's going to be an embedded amount inside of Medicare Advantage, and then there's going to be a supplementary amount. Now, the supplementary amount you could say, doesn't work or, it's not really worth it. But there are going to be some interesting, important things here. Like there are going to be important things here. Skipped features, hooray. Skipped frames, hooray. Jesus. Which is that the differences here are going to be that this portion here are going to raise your out-of-pocket maximum. Your maximum benefit amount. So embedded is going to have X. The extra is going to have Y. So X plus Y is going to be your total amount of benefit maximum in a year, which is not valueless, right? I mean, this is not something to be, this is a big deal because of the fact that this number here, the embedded amount, is similar to that of the private market, 1,000, 1,500. If I get an extra 1,000 of possible maximum benefit, that's going to be very beneficial to a certain set of people. That could be you. Here's your life hack, is that you don't have to add this on top of Medicare Advantage from the beginning. In fact, here, like I said, here's your life hack, which is that I generally tell persons, if you're on Medicare Advantage and you're not certain, you just wait. And then you go to the dentist at the very front of the year. And then, and only then, do you then call and add the supplemental because you found out that you're going to require a lot of extra services. Then this supplemental becomes valuable. The candid reality is that this is not generally speaking, one of the main points that I make. In fact, I can't even mention this difference here to clients, prospects, etc., that are looking to get some Medicare guidance. That doesn't mean that it doesn't exist. Now, I've also made this point about Medigap. For Medigap persons, actually even trickier, because now you don't get this because it's not inside of Medigap, where it is inside of Medicare Advantage. So now you've got to go just buy it yourself a la carte. Buying it a la carte is generally somewhat weaker than what's inside of the embedded of Medicare Advantage. This is the issue. The Medicare Advantage carriers have done well. I mean, they're smart. They know that people are out there looking for this extra coverage under dental. They realize that it has cost. Yes, and also it has these extra, effects towards people's health. that's what, of course, the dentists, have been claiming the entire time. Well, the terms and conditions inside of here are superior, can be easily superior to the a la carte dental and vision that you buy off the rack. For example, in here, there's no waiting period. So right away you see it. Meaning that, let's just say you start in January of 2022 and there's a 6-month waiting period. Now it's the end of June. It's July 1 until your a la carte, your off the rack dental will address certain matters, whereas it would have done so right away under Medicare Advantage. It has a lot to do with the hockey stick that I've drawn. Please go see the other videos because it's all over the place. This is not a big secret to me about the fact that this is very nuanced and complicated. All right, let's just take a look at this. This is a pretty big headline here. So this particular carrier is being accused of defrauding Medicare of $1 billion. This is not a small amount of money. Obviously, this is not a small media source. So Kaiser, for persons living in California, everywhere you go, there's Kaiser, right? The hospital centers. They are owners of Medicare Advantage plans, right? Whistleblower: members of Kaiser Permanente's healthcare consortium defraud Medicare out of $1 billion by altering patient medical records. So this is called upcoding. This is known, right? This is known, meaning that this practice has been suspected in a number of places. If I look at Medicare Advantage upcoding, so it's big, it's credible when the smartest guys in the room are reporting about it. Right. So it's not only Bloomberg. This group over here, by the way, up in the upper left-hand corner, National Bureau of Economic Research, that's the undisputed cream of the crop. Undisputed. Okay. And you can see it here. So the evidence has been here. You can see this article is September 2015. This has been known. This is not new. Risk scores for seniors increased for reasons not explained by declining health or regional differences. So the way this works is the following, is that, how do I explain this? Okay, so it's like you've given your adolescent child an allowance. And that's what basically the federal government does here. If you enroll in Medicare Advantage, the federal government gives the carrier an allowance. Now let's just say you're the adolescent child and you require extra tutoring, right? Because you have a learning challenge. You're learning challenged for whatever reason. You, the parent, give the child extra allowance in order to accommodate for the extra tutoring requirement. That's upcoding. Meaning that if you're an enrollee in Medicare Advantage and you have a health situation, a special one that they suspect is going to require extra amount of healthcare services and therefore incur extra costs, they tell their parent, the CMS, they get a bigger allowance. The issue here, what this claim is that the carrier is telling the parent, hey, I've got a bunch of sick patients when they're not as sick as reported. That's upcoding. Mom, Dad, I need extra allowance for tutoring services, even though I have an IQ of 140. And for that, you can see what ends up happening. To add diagnoses after the fact that either didn't exist or are unrelated to patient visits, the Department of Justice is alleging. This is some pretty tough stuff. This is a complaint filed Monday, this past Monday. And now you can see here in its statement on its website, Kaiser Permanente said it's confident it's compliant with Medicare Advantage requirements and intends to strongly defend. Okay. I'm not here to say this absolutely did or did not happen. Didn't. I'm not going to be saying that. Am I going to say that this is surprising to me? However, the answer is no. You can see it here. There's just another article on September 14th. Same thing. And there it is here. Independent Health Association and subsidiary Independent Health Corp are accused of obtaining higher Medicare payments by implementing a risk adjustment program that in fact made it enrollees in their Medicare were sicker than their medical records said they were. And I don't even have to, read the rest. It's the same thing. Because if the child gets the extra allowance, they just get the extra allowance. Now, in addition to that, it's kind of like you're telling your child, look, the child says, Mom, Dad, I'm a C- student. So they've reported wrongly, or the suit's alleged that they're wrongly reporting that they're a C- student. To make things more extreme, what ends up happening is if they actually end up getting a B-, well, the child's outperformed expectations, and now the parents give them even extra money. That can happen. That's an ACO, Accountable Care Organization. So now you can see some nasty soup here. That's what is going on. That's what's going on. And then there's the kind of the punchline, which is, and this is kind of why I don't make too large. So first of all, let me just say that I'm not sure if this is true. Let me also say that I'm pretty sure it's going to be very hard to prove, right? Unless you can prove that they're doing so intentionally, systematically, it's going to be tough. And the reason I say that is because there's still randomness involved, right? I mean, for example, you could have type 2 diabetes, and one person having that same medical situation has a slew of different health issues that another person directly across the street doesn't face with the same exact diagnosis, same diet, same everything. We've got this randomness here, and whether or not the government can actually prove that the carriers is twisting it to that degree beyond the randomness, that sounds tough. That sounds tough. And this is basically a statement I've made in the Maximize Your Medicare newsletter for years, which is, yes, are the financial incentives here high? Yes, they are. I've just kind of given you the 5,000 foot view, right? They get a bigger allowance, and also you can, if you outperform, you can get even more allowance for outperforming your expectations. True. All that's true. Now, the thing is that whether or not you can actually prove that statistically beyond a doubt, to the point that you can prove fraud, I'm going to let the statisticians, grind away, if you will. And I would say the following, which is that appears to be what this conclusion is. And of the groups that you don't want to mess around with this conclusion, this is one of those groups, for sure. They will have the academic chops, right? This is not going to be a group that is just sitting there for out of some partisan reasoning. philosophy of government reasoning. It is very unlikely that persons inside this group fit that description. This is the pure economics for, academic, purposes. Many of the very, highest quality of economic research sits in this group. So I'm not here to say I'm going to be the last person to throw a rock to say these guys don't know what they're talking about. You won't, almost impossible that I'd be saying that. Okay? So the fact that they're showing up with this type of conclusion coupled with this, I'm going to let you decide by yourself. The punchline here is not actually this news, right? I've just given you kind of a news update and kind of how this thing occurred, how it occurs. The thing is I'm not entirely sure that you as the beneficiary care. Because, if we look around our society and say, okay, we know that this is wrong, we know that's wrong, we know this is wrong, we know that doesn't sound right, doesn't feel right. Is this anywhere on your top 10 list? I doubt it. And the fact of the matter is that you're the beneficiary on an individual level, getting the benefits at the price that fits you. So the fact that, we've got this controversy between the seller of the card and the federal government, and that's the kind of very delicate point. And does this make me a bad person? Perhaps. In which case you would have probably concluded that before this, right? My opinion here, and it's not even an opinion. What it is saying is that, look, if you're actually the Medicare Advantage card holder, and you are getting to see your doctor for $0, if you get vouchers, if you get embedded dental and vision, are you really concerned with this situation? The answer on the individual level you can see the rationale can be no, you don't care. The flip side to that, and there's always a flip side, is the fact that, yeah, you could say you don't care, except this is your tax dollars. This is your tax dollars, right? So before we get on our, behind the pulpit, before we do that, we have to think about that. And again, this isn't really the politics zone, right? Shouldn't, wouldn't, like I said, does this show up for me that does this show up for Jay? That this is the top 5 of the things that should not occur in our society? Probably not. Does this make it right if this is occurring? It certainly doesn't make it right, because that extra allowance is coming from the fiscal pot. And fiscal pot is code for your tax dollars. Can't get away from that. Third segment, last segment here today. Let's just take a look here. And I'm going to, it kind of has to do with the shorter video we saw. Here it is. On November 8th, 5 p.m. Eastern, I'm going to be having a live webinar. You have to be a paid subscriber to Substack in order to access it. In addition to that, the recording will also sit on a hub, a place where only subscribers can access. Okay? The federal government, the FEHB, this is the largest group plan in the United States, federal employees' health benefits. Covers 8.2 million. You can see it right here. Brutally complicated. I don't think there's any question about that. right? In other words, you can see all of these different states lists, etc., etc. We go to the states list, and now you just is called Minnesota, and all of a sudden you will see tons of plans. Okay? And every state is going to have a lot of these plans, whether you go state by state, etc., etc. I'm not here to tell Mr. X living in Montana that they should take a particular plan. For that, can I give you that counsel? Yep, I probably can. You'd have to send me an email, but the answer is yes. It becomes more complicated because in here are different combinations for persons entering retirement or considering retirement. All of that will be considered and displayed on November 8th. However, the main thing and the kicker, the frosting, the candle on the cake here is the fact that this is just a singular example of something that I'm very sure happens around the country all the time, but people gloss over. And it has to do with the fact that the annual enrollment periods, the open enrollment periods for your employer, is probably right now. And will have slightly different windows than the annual election period. You may already be 65 and working. Your spouse may or may not be 65. You may have a 25-year-old child. And all of these things are moving around at the same time with different enrollment windows, which is just nuts. So basically what ends up happening is, let's just call the federal window this for Medicare. Let's say your employer window is this. What has that done? That has cramped down the actual window to this. So what looked like October 15th through December 7th for Medicare is actually October 15th to, okay, well now all of a sudden your employer doesn't start until October 30th. Well, now the beginning for you is October 30th, isn't it? Now what you thought was 7 weeks is now 4 weeks, 5 weeks. This is a complicated set of things. In fact, I get an email about this pretty much every day. That, I wrote Maximize Your Medicare, MaximizeYourMedicare.com, available on Amazon, blah, 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 blah. The more complicated stuff, I'm spending more time on this. I just don't see a way out of that. In other words, I don't see any way that this is going to become less complicated. Because all of this thing means that you then have to enroll in federal Medicare, which involves red tape. There are times and dates that there are these delays by which you can turn on Part B. It is crazy. And to manage all the components, you need time to prepare. You need time to prepare. The candid reality is that I'm setting the date for the webinar for November 8th because of the fact that it's dealing with 8.2 million people. That said, the reality is that for other companies, November 8th may be too late. Maybe it's November 15th through the end of the year. I don't know, because there's no federal rule to say every company must renew by what dates. Okay, I can tell you that GH2 Benefits is broker to small employers for their benefits plans. We've already vetted this a couple of months out. We've looked at the census. We've already discussed individuals where they should reasonably, by their own volition, possibly voluntarily eject themselves. Yeah, that is in fact the case. That can be the case. That also exists at large employers. The Affordable Care Act and the extra advanced premium tax credits have, in fact, notably changed the balance. Notably. That's some food for thought. I'm going to get into more of that on November 8th. candid reality is if you already know this fits you, your best time is today. And just to send us the email to tell us who you are in the situation, the 5,000 foot view. We'll take it from there. info@gh2benefits.com. That should get us on the right track and needs to be done immediately, because this kind of thing, this exercise here that you see on the screen, choosing amongst plans, looking across all of these plans, you can just see this. So now you can see all of this active employees, employees and annuitants, etc., resources. I don't know if I'm going to look at this during the webinar, the live webinar, right? And without, I'm not going to tell you that the information is wrong. But again, much like most of the resources that are available, it's not factually wrong. Factually wrong, I find it difficult to believe. Right? They're not going to intentionally misrepresent. That part I don't think is going to exist. However, to have the information required to make the decision that fits you in Florida is going to be different than your cloned brother in Arizona, which is going to be different from your brother's wife who lives in Oklahoma. You can see the dizzying number of plans. Again, we're not even to the end of Alabama yet. We've just now hit Alaska.